long term general follow up normal. But first, we'll start with the scenario for you to have better understanding. Adele is a 30-year-old woman in her 34th week of. She noticed an increase in weight, swelling in her legs, and her urination has become more frequent. She is concerned if these changes are normal or not. She presented to the doctor who ran some tests which came out normal and informed her that those changes are normal. However, Siju, her friend, experienced similar symptoms and was diagnosed of preeclampsia, seeing her BP was very high. The entire changes in the body during pregnancy prepares the mother to meet the demands of a growing fetus. These changes are important to provide the baby with nutrients, oxygen, and removal of waste products. This happens through a very important organ formed from both baby and mother tissue called the placenta. The placenta maintains by facilitating the transfer of oxygen, energy, vitamins, and minerals from the mother's blood to the baby and removal of waste materials such as carbon dioxide. Various changes occur in the body, some of which we can see. Others occur internally, which we cannot see. Obvious physical changes are weight gain and altered body shape. Weight gain is due to increase in breast tissue, blood volume, and fat. However, the average weight gain during pregnancy is 12.5 kg. See our video on weight gain in pregnancy to learn more. Here are some of the changes we will discuss. Change in the vagina. The vagina becomes more flushed so as to prepare for the eventual exit of the baby. This is associated with increase in vaginal discharge. The quantity of normal vaginal discharge, which is clear or whitish, commonly increases. This increase is usually normal. However, if you notice the discharge has an unusual color or smell, or is accompanied by vaginal itching, you should see your doctor who will provide the treatment. Do not attempt to treat yourself, as some drugs are unsafe in pregnancy. See our video on medication use in pregnancy to learn more. During pregnancy, your heart works harder because there is extra need for blood supply to the fetus. Therefore, the heart needs to pump about 1.5 times pre-pregnancy level, thus increasing your heart rate. Even during exercise, your heart works faster. Well, despite the increased body demand, the blood pressure usually decreases during the second trimester, but may return to a normal pre-pregnancy level in the third trimester. Should there be any elevation of blood pressure during pregnancy, your doctor may suspect preeclampsia, which is elevated blood pressure and protein in urine, which can lead to seizures. Due to increased demand to supply the entire body function, you have to produce added sounds which are called heart murmurs. Sometimes you may feel these irregularities such as palpitation, which is feeling your heart beating fast. Such changes are normal during pregnancy. However, your doctor will run some tests and examine you to confirm, especially if you have had frequent palpitations. Changes in uterus and abdomen. The fetus grows in the womb, and as it grows, the uterus, a muscular organ, increases proportionately. Changes in the uterus and abdomen. Changes in the uterus and abdomen. The fetus grows in the womb, which is the organ, and as it grows, the uterus, a muscular organ, increases proportionately in preparation for expulsion of the fetus. Sometimes, the enlarged uterus causes the return of blood and other fluids from the legs and results in swelling, also called edema in the legs. That is why in the legs. That is why your legs appear swollen, which is really normal. However, if you have hypertension or you have hypertension and have protein in your urine, it might mean you have calcium. Speak to the doctor about this condition. Changes in the urinary tract. Like the heart, the kidneys work harder throughout pregnancy. They filter the increasing volume of blood. The volume of blood filtered by the kidneys reaches the maximum between 16 and 4 weeks and remains at the maximum until just before the baby is due. Then pressure from the enlarged uterus slightly decreases blood supply to the kidneys. Also, the enlarged uterus presses from the bladder, using its size so that it fills the urine more than usual. This pressure also makes the pregnant woman feel the need to urinate more often and more urgently. Pregnant women are advised to drink more water and wipe after using the bathroom from front to back. Change, changes in the respiratory system. The high level of progesterone, a hormone produced continuously during pregnancy, lowers the level of carbon dioxide in the blood. This then activates the lungs to work faster, so the pregnant woman breathes slightly faster. To be able to control your breathing better, yoga and deep breathing exercises are recommended for pregnant women. Changes in the digestive system. Nausea and vomiting, particularly also called morning sickness, are common. This is as a result of reduced movement of the bowel caused by pregnancy hormones. Thus, conditions such as heartburn, constipation, and hemorrhoids are quite common. Changes in the skin. The increase in blackheads and pimples are usually as a result of the hormones. This is due to increased secretion of sebum, which can clog the pores, causing these skin changes and body odor. Thus, it is required that you bathe at least 2 times a day and use deodorant regularly. Also, the skin surrounding the nipples, called the areola, may also darken. The dark line commonly appears down the middle of the abdomen, called linea alba. Stretch marks sometimes appear on the abdomen due to tension on the abdominal skin. All these changes are normal and you should love your skin despite the transformation. In most cases, your body goes back to normal after pregnancy. Changes. The joints and ligaments, which are thick cords and cartilage that connect bones in the woman's pelvis, loosen and become more flexible. This change helps make room for the enlarging uterus and protects the woman from delivery of the baby. As a result, the woman's posture changes somewhat and may experience waist pain. In addition, the spine calls more to balance the weight of the enlarging uterus. Avoid lifting heavy objects. Do well to bend the knees, not the waist, to keep things up, and maintain good posture when sitting or standing or walking. Wearing flat shoes with rough soles or a lightweight maternity girdle may reduce strain on the back. In conclusion, it's important to track the changes you experience during your pregnancy so as to detect any abnormality in trend. When was the last time you checked your weight?